So the interventions to improve the competence and confidence. So teaches caregiver how to design and carry out plans that focus on medical and psychosocial problem, teaching how to manage specific patient problem. So the caregiver should be very competent as well as confident in order to do the care or carry out the care for an elder person. So we have to teach the caregiver in a way that how to carry out the plan accordingly in a most acceptable way or most simple way. So that should be focused on medical as well as psychosocial problem so that the problems will be solved and further problem will not occur. All the problems are should be expected. So while teaching the caregiver, we should teach in a way that problems are always expected while taking care of elder persons. So what happened next is not predictable. So in or an elder person is a person like very potential person to go in a critical situation in any time. So teaching how to manage specific patient problem. So that is also important. And finally, potential harm. So we doesn't know while we arrange caregiver how the caregiver will react to the older person. Maybe the caregiver will be very crooked or can abuse the elder. So while selecting the caregiver, we should select in a way that they will act normally with the elder person. So risk of elder abuse, we have to counsel as well as we have to support. Problem solving skill as well as coping skill should be taught while we are counsel the caregiver. So if a caregiver is not having much knowledge, medication error can be occur. So educate about drugs as well as possible side effects. So that is all about the 6 points in role of nurse for caregivers of elder persons. So who are these caregivers? So caregivers can be formal caregivers as well as informal caregivers. As I have told before. So who are formal caregivers? Formal caregivers are paid caregivers providing care to the person. So it refers to a range of home care and community support services provided to older persons by a mix of providers includes it can be included nurses, personal support workers, occupational therapist, physiotherapist, dietitian or community support services. Formal caregivers are located in the home of the patient if it makes sense to give home care. So while if the patient is admitted in the hospital, in that cases also we can arrange formal caregivers in order to stay with the patient in the hospital. So formal caregivers are paid caregivers. They can be nurses, personal support workers, occupational therapist, physiotherapist, dietitian or community support services. So what about informal caregivers? So informal caregivers are care providers without receiving money. That includes family as well as friend. So it refers to a range of emotional and instrumental support provided by the social network, neighbors, friends, as well as family members. That is informally given care by even the social network, neighbors, family, or friends. Informal caregivers needs training. So that is the main thing. To provide medications, informal caregivers need training for administering medication, injections, lifting, as well as turning the patients. That is only the difference. Formal as well as informal caregivers. So what are the role of caregiver? To give care to the elder person, right? So they can be act as advisor, consultant. They can be act as a teacher, they can be a sponsor, organizer, or a coordinator. So what are the responsibilities of caregiver? Maintain a safe, clean, and healthful environment for the patient. Care for the patient welfare socially, intellectually, spiritual, physically, as well as emotionally. So in all aspects, we have to care the elder person. Socially, intellectually, spiritually, physically, as well as emotionally. Finally, guide and assist the patient in their personal hygiene. Prepare meals as directed. Medicine preparation and administration properly in time based on the prescription. Inform when rehabilitation is needed. Caregiver must be a good listener. So these are the responsibilities as well as role of caregiver. So that is all about role of nurse for the caregivers of elder person. So that is all about today. Thank you so much.